role of early help, SEN support, and how the local offer start to fit together and create some opportunities both to share some of the practice that we've been hearing about nationally, but also some of the work that I'm sure some of you might have been doing in your local areas. So I'm going to start off just talking a little bit about social care needs and, of course, the importance that is starting to be developed around how that works in the EHC needs assessment and planning process, but also thinking about that in the context of early intervention and some of the frameworks that exist before we get into the statutory framework of education, health and care planning. So obviously, I think it's fair to say that we're all aware that the first, starting point initially around understanding a child or young person's social care needs is engaging with children and young people themselves and their parents, and understanding really their experiences of life, the way that their needs affect them and affect their ability to be part of their families and part of their communities. And in any assessments, focusing on enabling the child or young person to achieve specific outcomes is central. And I think at the moment what we often see is kind of similar to what we see in the education, health and care system once we get into statutory support. Prior to that, we also sometimes see that kind of disconnect. So actually, when we're looking at SEN support planning in schools and colleges, often there isn't the same thinking around the potential for short breaks opportunities and what that might look like, and kind of opportunities for family support around the early help framework. So we all have social care needs. Everyone requires some form of support to meet these needs. But for many children and young people, in the same way that will be the case for many of us, our needs will be met by our family, by our friends, by our wider networks, by our work colleagues, and by our local community. And actually, this is where kind of a really robust approach to the local offer comes in terms of ensuring that families are aware of and understand the opportunities of support that are available to them. At times, though, it may be necessary for support to be provided through social care services which are delivered or commissioned by local authorities. And to do this effectively, social care services need to develop a clear understanding of the child or young person, their needs, and what kind of support they require. And for us to do this in a way that enables early identification of social care needs and early intervention to support promoting the welfare of children and young people, and to prevent kind of families deteriorating into crisis and presenting for a kind of full-blown social work assessment, actually we need to have joint sessions. Oh, I've got a bit of an echo. If people can pop themselves on mute, that'd be brilliant. Thank you. So I've just had a note in the chat to ask about the slides as well. The slides will definitely be coming out and the recordings of the sessions will be available as well. So this is just a little bit of information from a social care perspective around the different tiers and levels of needs. And these will normally be represented through the threshold documents on a local authority's website, available through their multi-agency safeguarding partnership, but also should be available in the local offer. So we know that most children and young people's needs will be met at level 1, which is kind of within universal services, within those things that are set out in the local offer. Level 2, where needs may require targeted services. So this could be as part of the early help framework. It could also be targeted kind of short break services, which are accessible via a pathway other than through a Section 17 kind of children and families assessment. And then when we start to get to level 3 and level 4, we're thinking about needs that potentially need to be met through a statutory support framework. So at level 3, we're thinking about support under Section 17, so children in need, and at level 4, around Section 47. And then we know that alongside this, that's been particularly highlighted by the Children and Families Act, we've also got provision under the Chronically Sick and Disabled Persons Act, which essentially delivers the majority of support that a disabled child or young person and their family might need, apart from overnight short breaks and respite provision, and also direct payments. And we're not going to go into that in detail today, but I will share with the slides that come out 2 new e-learning modules that CDC have developed around social care and SEND. So one of the really crucial things for me about these different kind of tiers often talk about in social care a continuum of need, right through from kind of universal services, local offer, early help, into statutory social care support is that actually we don't always think about this as a continuum of provision. And actually that's really crucial, because any provision that a child or young person might be accessing through universal services or the local offer should be the bedrock of their support, and any additional support as they move through these kind of tiers of need should be met in addition. So these should be layers of ongoing support and provision that can continue to meet the needs with additional top-ups from those statutory services. But what we sometimes see is children and young people kind of jumping through tiers of this system. So accessing universal services until a point at which that breaks down, then kind of leapfrogging into a child in need system because they've reached crisis. And what we want to do is look at how we create better join up across this early tier of the system to prevent some of that from happening. So this is exploring a little bit some of the principles around social care advice and information into an education, health and care needs assessment process. But what we're then going to do is have a think about actually what this means and what these principles mean really in terms of early help, SEN support and the local offer. And in fact, to also recognise that a young person who has an SEN support plan, for example, may already be known to statutory social care for a range of other reasons outside of their SEN or disability. So what we need to be thinking about across each of these plans, whichever plan happens to be the first kind of trigger for these conversations to be happening, is are there any other relevant services involved? Is the young person already in receipt of specialist short breaks and accessing services of that nature? Are they possibly on a child protection plan or a looked after child? And actually, what does that mean and how does that fit together with an SEN support plan? Information that we might then provide in a formal statutory request for advice around education, health and care plans. Actually, how might we think about getting that advice and information when we're thinking about these kind of non-statutory tiers of support in the system? We know that there should always be information gathered through engagement with the child, young person and their family, but what we're often hearing is a challenge is actually for practitioners who are not experienced in speaking about social care need, having those conversations directly with families can be really challenging. And although information is gathered through an SEN support planning process and around some of those other aspects of support, and equally through an early help framework, without necessarily the education lens, it can be really important to think about how we support practitioners to have that awareness and to think about how they connect the dots between those two aspects. So then where a child or young person has been known to statutory social care services or early help services in the past, when we're looking at SEN support planning, it's really important to establish that and think about how we connect in with those practitioners and build that team around the family. Now, we've got that approach built into the early help framework, but actually we need to be able to think about how we mirror that from SEN support so that this comes from both directions. So in terms of where we might get advice and information around social care, there's a whole range of professionals. And in fact, social care needs tend to stretch across a whole range of different interactions with young people. So more so than kind of education or health in that regard, we might expect to see social care needs indicated in advice or information coming from anyone who is engaged with that young person. So that could be teachers, it could be youth workers, it could be short break providers, it could also actually be providers of universal services. So this could be scout leaders, youth club leaders, anyone who has engaged with that child or young person on a regular basis. So after school clubs and breakfast and kind of breakfast clubs and things like that. I've got a feeling someone may not be on mute at the moment. I'm just hearing a little bit of background noise. So if everyone could just check they're on mute, that would be brilliant. So what we also know, we've also mentioned, it's really important to consider where a child is not already known to either early help or other frameworks, whether there might be any information coming through from conversations with the family or with colleagues that there are unmet social care needs, and how we might then understand what referral might be required, whether it's for early help, whether it's for a formal social care assessment, or in fact, whether it's working with a family to signpost them through the local offer to think about perhaps short breaks opportunities that might be available and to support families to know how to access them. So in terms of coordinating assessments and plans, we know that in an EHC needs assessment, we want this to be a holistic assessment, and that should happen when it's practical and appropriate to do so, that we should be combining both non-statutory and statutory assessments in order to do this. There are a number of considerations to think about within that. So information sharing is a really big issue that's come up for us across this whole process, particularly when we're thinking about young people on a child protection plan or looked after children's pathway plans. Actually, how does that link in? And those children will not always have an EHC plan. There could be a large proportion of those children and young people who might be on an SEN support type approach. And actually, how do we make sure that these kind of pathways that we're developing at the more statutory level also have a set of principles that reach down to those other tiers of the system? So I'm going to invite us to have a bit of a discussion now. So please feel free to kind of pop your hands up or put a comment in the chat if you're interested in kind of sharing. So what I want us to have a think about now is, in terms of what we've just talked about, do those same principles apply to the processes in relation to early help and SEN support in your areas? Are these things happening? Is there anything that you could share about it? And then perhaps what you see as some of the potential kind of barriers or challenges to supporting that join up happening in practice. So if I can just invite anyone who's interested in sharing anything, or anyone who's got any questions for me about what we've just talked about, just popping it in. So we've got a note in the chat box already, which I think is probably going to be reflected generally, which is about one of the main difficulties is around parents refusing early help support and refusing an assessment. So we know that actually consent is really important in terms of the early help assessment framework. And I think that's a really crucial point, and it is quite a long-standing challenge around some of the stigma that can be involved in having social care practitioners being engaged with families and understanding what the implications of that are. Has anyone managed to overcome that? Has anyone got any thoughts about the way that they manage that? For example, if a family's or if a parent is refusing to consent, where you feel that there is kind of a need for that sort of support, or anywhere where there's been kind of successful interactions with early help pathways and supporting families to see that as a supportive option rather than necessarily as a stigma and a challenge? If anyone would like to kind of unmute themselves and come in to join the conversation as well, please go ahead.
Hi there, Caroline. I seem to have lost my hand function to be able to put up, so I've just...
No problem, just wade in, that's perfect.
Hi there, so I'm Mark Mervyn, I'm the Assistant Director for SEN and Inclusion in North Tyneside. We've been working with CDC on developing an early help, a strengthened early help model, building on some of the learning across early help and MASH arrangements in social care.
Can I pause you for 2 seconds, Mark, and I'll tell you for why, because I'm going to skip forward a couple of slides, because I've actually spoken to Rebecca, your disco in North Tyneside, about sharing your example, but it will come far better coming from you. But I thought what I might do is just skip forward in my slides so that you can actually talk through a pathway of your process that I've set up on a slide, which might help people to follow it. So please carry on now, and I'll let you lead the way on this.
Yeah, I mean, I can talk a little bit, if that's helpful for people, about how we request statutory advice within North Tyneside, and then I was perhaps going to talk a little bit about some of the work we've been doing with CDC on developing SEND early help modelling. Is that helpful? I don't want to waste people's time. Is that helpful to people? Or?
Definitely, I think it would be great if we...
Okay, so I suppose if we when we get a request for an EHC, I mean, I'm sure the local authorities have similar approaches. When we get a request for an EHC needs assessment, we send all, and we agree to complete an EHC needs assessment, we send all of our statutory request for statutory advice into our MASH. So in children's social care, we have a MASH. As part of my role, I also have responsibility for our whole life social work model, kind of a birth to death disability social work model. What we did is within our MASH, we have a disabled children's social worker that's co-located in the MASH. And so any request for statutory advice that is made about a child who has a disability, it's the disability social worker who completes that statutory advice. We think they are best placed to understand what is in our local area, in our local community, to undertake that statutory advice. And what we have found is that as a result of that, we have seen more children and people who have then gone on to have an early help assessment. And we have had some that have then gone through to require a social work assessment. So we found it's not just about having the conversation, but making sure the right people are having the right conversation. And we've found that that kind of more nuanced knowledge of a social worker from our disabled children's team enables that conversation to be much more rich than what is often in our MASH a social worker who has got a safeguarding hat on, who's got a lot of other competing priorities. If the child has opened early help, the request for statutory advice goes to the early help practitioner. If the child's already open to social work services, then it would go to them to complete that assessment, that statutory assessment advice, for it to then come back into us. Is that what Rebecca was talking to you about?
Yeah, that's right. And kind of also just kind of pulling together the fact that there was that kind of for every case thing, because we know that there's been a lot of feedback from the tribunal around this kind of issue as well. So thinking about the fact that actually you now have a really well evidenced process that demonstrates that an informed conversation has happened with every family that comes through this process by a skilled practitioner that explain. And I think from our point as CDC, we think that skills and knowledge bit is really crucial. We wouldn't necessarily say that it has to be a disabled children's team social worker. We know in other areas there are kind of other models using kind of family support workers and things like that, with kind of social work supervision, and thinking about how those models fit together. But I think for me, it's that real clear process where you know that every family has had the idea of a social work assessment discussed with them, that a professional judgment is made based on information that has been gathered in a consistent way, and that families are signposted to the local offer. They're told about the disability register, and that's something that happens consistently for every family that comes through this process now, and you're able to evidence that, which I think is really supportive in terms of being able to demonstrate that that engagement and that commitment to social care, supporting social care needs of families.
I think what's also helped, Karen, is that Rebecca, as our DISCO, also regularly undertakes audits of their statutory advice. So we're able to see some of the distance travelled in the quality of the advice. And I think probably just latterly, what I would also say to others, and I'd be interested in what works for other local authorities, because we're all kind of on that journey of trying to strengthen what we do. But one of the other things that's been particularly helpful is that for all our partners across education, health and care, we now send a scorecard to them every Monday with all the advices that we've requested from them, and it's RAG rated. So those under 4 weeks are white, those that are amber are 4 to 6, and those that are over 6 weeks are red. And every Monday they receive that. And for social care, what we do is when they get that report, it tells them who the SEND officer is, but we've been able to cross-reference that with the named allocated social worker or early help practitioner, because I'm a social worker by trade and a social work manager by trade. So, you know, if you've got 30 advices that you get a scorecard for, and you don't know who the social worker is. So we've been able to do a lot of work on cross-referencing where there's an allocated worker, so the manager can go straight to that worker and say, where are you with your advice? But that has also strengthened the timeliness of advices.
That's a really helpful suggestion as well, Mark. Thanks for sharing that. I know I sort of pulled you off course with your original comment, which was going to be a bit more focused on the kind of early help SEN support level. Is there anything else you wanted to add in relation to that aspect? I
suppose I'm just interested in what other people are doing around strengthening their early help SEN offer. We've been working with Amanda in CDC to develop an early help SEN model. So I mean, in most local authorities, they should or will have a really well tried and tested early help arrangement moving through into statutory services, and we've been taking some of the learning from in North Tyneside and building a similar approach, and we're currently scoping out almost a similar MASH model, but within early help SEND, but with a much stronger focus on SEN support. And I was just interested in what other people are doing and what they're up to.
And I think certainly what we're hearing more and more in CDC now is areas setting up almost a disabled children's early help team. So having a series of early help practitioners with that specific specialism around disabled children and SEND and the needs of those families, but perhaps sitting within the wider early help team. Deanne, I can see you've got your hand up in the kind of list. Did you want to come in on some of this?
Yes, please, if you don't mind. Hi, Mark. I'd really like to have a conversation with you about, so obviously we in Newcastle, we've just recently, a few months back, introduced a similar process in respect of new plans and new requests for EHCPs to make sure that a social worker contacts a family who is skilled and experienced in SEND. I have a concern because I've got a huge number of EHCPs that haven't necessarily gone through that process. So I'd really like a conversation with you how you've managed that in North Tyneside. You know, your plans that you had in place prior to this strengthening of the process, and how you made sure that the EHCP reviews either considered the process that you've got in place now, or what strategy you use to strengthen the social care aspect. Does that make sense?
Yeah, I mean, I think what we've probably, I would never say fixed, but where we're much closer to that is our new assessments. I think I think you raise a really interesting point around annual reviews and the quality of advice and information that's requested prior to the review, and we're not, we haven't overcome that one at all. I mean, one of the conversations that we are having with social care is if you complete statutory advice for a 5-year-old where the view was that they didn't require a social care need, at what point do you go back to seek updated information and advice? And I think there's something in the code, but people might correct me, I think there's something in the code which infers that you almost should be going back much more regularly for information and advice from social care. And so the conversations I'm having with my counterpart, the AD in children's, is we might start looking at transition points. So children that are in year 5, because we want to really start thinking about transitioning earlier than year 6. So perhaps looking at requesting information advice for young people in year 5, because we know we see some peaks in year 7 of children, young people where you know, we come into kind of exclusions and where school placements break down. But I mean, I don't know what other local authorities are doing, but that's, you know, we certainly would not have the capacity for to go back to social care every year. But if we could perhaps look at some particular points in children's journeys where we could seek updated information and advice. But it does mean that there is going to be a significant proportion of our EHCPs that don't have robust children's social care advice. I mean, the only thing I would probably just add to that, Deanne, if it's any help, is that when we've been auditing, we do quarter 1, 2, 3 audits, is we audited historic plans for quarter 1 and 2, which did evidence the social care advice wasn't as robust as we'd want. And then we audited quarter 3 and 4, which was much stronger. So we haven't had our inspection yet, but we've now got a narrative and an evidence narrative that whilst this is where we were, that isn't where we are now.
Yeah, that's really helpful. That's really helpful.
I don't know what other people are doing around that.
Thanks, Mark.
Thanks, both of you. Is there anyone else who wants to come in on this point? We have got we're running probably slightly short on time, and we have got a couple more discussion points. So I know that we've got one comment in the chat from Raj, which talks about in early years, working with parents where social care links are needed feels better, which might be because the services are working more closely together more generally. So health and specialist education have good links and are working in family homes, but that it can be more difficult with kind of school age children as you move up that system, because perhaps the kind of close working with families starts to separate slightly, which I think is a really kind of helpful point for us to reflect on in terms of some of the next kind of stages of this. So I'm just going to move us forward, and what I wanted to do was just introduce to people an audit tool around social care that CDC developed a couple of years ago, which is part of a suite of audit tools. I've got some instructions in here about how to use it, but I'm not going to go through those in detail now, other than to just flag that there are 5 sections that go through a series of kind of implementation prompts and then key indicators or evidence around practice. And it's designed to be a dynamic document that can be used to support local areas to do some of this auditing work at a kind of systemic level. And there are some aspects of it that focus on kind of early help and SEN support and think about some of the key indicators. And I just wanted to share them with people as a bit of a framework. So the first one we've got here is around, do early help practitioners understand their role and responsibilities in relation to SEN support and in relation to the EHC needs assessment and planning process? The high quality and so the indicators for this might be that there's high quality training for early help practitioners, which enables them to contribute meaningfully to SEN support planning and to the education, health and care needs assessment and planning process, and also that the local offer supports practitioners and families to know how to access appropriate pathways for support. So that could include universal services, short breaks, early help, and children's and adult social care services. I've just had a note in the chat about the e-learning. We're actually launching it next week in our CDC newsletter. So as soon as it's live, I will make sure that it gets also communicated to everyone who signed up for these workshops as well. And so then the other aspect of that is around, is there a clear process for sharing relevant information related to social care needs as part of assessment and planning processes? So this also, I think, works both ways. So we talk here about early help practitioners are supported by the training to identify information relevant to a child or young person's SEN, but also looking at whether SEN support colleagues in schools, SENCOs, are aware of the early help processes, how to feed into those pathways, what that looks like. And I suspect in that direction, it's more likely, just because of the fact that often we might have had school leaders as professional leads for kind of team around the family approaches within early help, but it's actually really understanding where that's coming together as a result of SEN and disability, and in terms of kind of short break practice and pulling that team together around the family early. So we've talked through this. I'm going to leave this slide in so you've got some information, and I'm hoping to be working with Rebecca just to clarify the DISCO role, which I've mentioned a couple of times on this in case anyone isn't aware of it, is the designated social care officer for SEN, which kind of replicates the roles and responsibilities around the DMO DCO in health. There's more information about this, and I am very much hoping to be working with Rebecca in North Tyneside, and perhaps with Mark if he's open to develop a bit more of a detailed learning example as they continue to progress on their journey around the work that they're doing. And these are just a couple of things to think about. So are the children's workforce across education, health and care supported to recognise the needs of children and families who may require early help? I know that there are a number of sessions I've run over the last couple of years where there's been a kind of distinct feeling that perhaps the early help framework wasn't intended for disabled children and young people, which is sometimes around the definition of children in need in the Children Act. But we worked quite hard in the most recent updates working together to make sure that disabled children were featured in the list of kind of potential children and young people who could be supported by the early help framework. And I think it's really important that we're making families and kind of other broader practitioners working with children and young people aware of that. And then also, is there a clear process in place to ensure that where children and young people are engaged with SEN support, that there is a holistic approach to planning, which includes health and social care needs at that point in the process? So what about the local offer? Inevitably, the local offer absolutely underpins access to universal service and supports and short breaks, and pathways into these wider statutory services across local areas for young people. So here are just a few indicators again from the same kind of audit tool. So actually, is the role of social care in the EHC needs assessment process clearly defined in the local offer? And what we're often finding now when we look at an audit of the local offer is there might be a link to a local authority threshold document, but actually often they are quite difficult to kind of digest and kind of manoeuvre through for families. And actually really what is needed in the local offer, and actually what we as CDC feel is probably the responsibility of social care teams in terms of providing, is some really accessible information for families about the purpose of social care support, the purpose of the early help framework, what they can expect from an assessment process, and what the eligibility and threshold criteria is around that. So we've kind of talked about the eligibility there. So this is about the indicators around accessible information about pathways, the kinds of support that might be available, a really clear understanding of what short break support is available without a full assessment. Okay, so then and then also thinking about that transition and that looking at preparing for adulthood phase, does the local offer include support with preparing for adulthood and transition? So another couple of things to think about in the context of the local offer. So is all this information in it, including eligibility for short breaks, early help and statutory social care? And how is the local offer used to understand unmet need and amended to reflect new services and provision commissions? And these are things that may not necessarily be the explicit responsibility of the people on this call, but actually there are some really important reciprocal responsibilities in terms of making sure that the local offer has up-to-date information, and really it's going to be people in services with the expertise around what should be available and what needs to be available, and about that population level need, that need to be able to be involved in that gap analysis of the local offer to be able to feed that into joint commissioning processes in order to kind of join the dots between all of the different layers of this system. So we've got about 5 minutes left on this before we need to jump, in fact probably 3 minutes before we need to jump into the next session. I know my colleague Tamara is going to be popping a link to an evaluation into the chat box, but these are just a few things to think about in terms of anything else that anyone wants to share. So what are the processes that could be put or are in place to ensure social care needs are identified and recorded early if the child or young person is not known to social care? And we've obviously talked about a couple of examples of that. How are social workers across children's and adult services or early help workers made aware of their responsibilities in relation to the processes that we've talked about? And are social workers clear about the type of information and advice, and actually early help practitioners, that they're expected or needed to provide as part of some of these assessment processes? The only other thing I was going to flag here is that there is a couple of resources that CDC developed around identification of social care needs in the early in this kind of early identification, early intervention phase. But also one of the really crucial things I think to pick up on is that there's often a misconception that early help is about early years. And actually, that's why we deliberately flag here about adult services and understanding those kind of transition teams, and that from kind of year 9 onwards focus on preparing for adulthood in terms of thinking about what are the kind of different aspects of where early help for a family to prevent needs deteriorating and to support and promote well-being and to promote the welfare of children and young people is really vital around this tier of the system. Okay, folks, so I'm sorry that we've kind of come to a bit of an end. If anyone's got any questions that they'd like me to pick up after the session, please do post them in the chat before you move on to your other workshop. But I hope you found this useful. The slides will be shared along with any links to any resources that I've mentioned during the meeting. Thanks, everyone, and we look forward to seeing you again soon.
Thank you.